Thank you so much for joining us today, Jess. We really appreciate you taking time out of your busy schedule.
Of course, happy to be here.
Absolutely, absolutely. Let's jump right into our questions for you today. Your job is not easy, and I find almost everyone in behavioral health has a specific reason for being in behavioral health. Would you mind telling us your story about how you got in the field?
Yeah, so I have kind of a funny start. I actually started undergrad majoring in theater, so did a bit of a curve there. But I
Yeah.
grew up with my uncle with Down syndrome who lived with my immediate family, so he was more like a brother growing up. So I kind of had that perspective of like having a family member with a disability and how taxing and how much it can take from the whole family, not even just the main caregiver. But like I said, I went to undergrad. I was like, I'm majoring in theater. I went to a theater high school, so it was like, this is perfect. I had gone back to visit my high school while I was in college, and I had a teacher that was at the theater school that said, you know what, Jess, like you have like a really like different view of like people with special needs, and like you really should use that, and I don't think you should waste it. Not that you're not good at theater, but we think that you could make a bigger impact on the world. And that's an area that where you're really needed. And so I kind of really thought about that, and I went back that next semester. I changed my major to special education, which isn't still quite ABA yet, but I worked on a research project with Dr. Joshua Plavnik at Michigan State University. While I was in my undergrad, I still went on to do my student teaching and get like my certification in teaching, but then I went right back into my master's program and started getting my master's degree in ABA. So that's kind of the little bit of a journey there.
Yeah, yeah, that's funny. From drama major to doctor is not a normal not a normal path, but very cool, very cool. So you've taken toilet training research from kind of the lab to the real world clinical setting. What's one kind of surprising lesson that changed how you've approached early intervention, especially?
Yeah, and I don't know if this is even surprising per se, but we know that data isn't always enough, right? And so pairing data with empathy and that whole family kind of perspective, understanding like family stressors, routines, values, and really kind of putting that context into that family model really makes interventions more successful. And so that paired with that, right? Parent training is everything. We know that the most effective outcomes from all of ABA comes from when parents are deeply involved and deeply bought in. They're confident and not just kind of going with the flow. And then when they understand what you're doing in the clinic so they can do similar things, maybe not to the same intensity that you're doing in a clinic-based setting, right? But so they can do some of those same things at home and really promote that generalization because it doesn't happen naturally all the time. So we need to make sure that we're looping families in from the beginning and really getting that buy-in from the beginning.
That's awesome. That's awesome. I have a couple of clients that are also in the well, several clients in the ABA space, but several that very specifically focus on family training. I think it's so important.
It is, yeah.
Absolutely. So you're in a pretty competitive space. How does your team go about gaining new clients? What's working well for you right now?
So we're kind of in a unique situation where we are only clinic-based services right now, and we only have capacity for about 12 kids at a time. So we have a pretty little max out right now, right? We're hoping to grow with ethically grow in the future, but right now we're capping out at 12. And one thing that I really liked when I was interviewing for the position I'm currently in is that Intermountain didn't really look at ABA as like a competition, an ABA program as increasing access to care. In Utah, there's wait lists that are over a year long for some companies, and so it was really important to them as a hospital system that has a pretty big name in Utah to be able to expand services and access to services for families because they do diagnostics, and they were hearing from a lot of families, we're getting this diagnosis and then we're not able to then get access to the services that people are recommending to us. They're not necessarily looking at it as a competitive space, although it is, just because we are so small right now. I'm sure in the future that potentially could change, right? But right now we're really focused on quality over quantity and really focused on doing it right in this small clinic so then we can try to replicate it ethically in the future and doing that at a speed that makes sense and that we can still kind of promote quality.
Absolutely, absolutely. So as your team has grown, I know you are in leadership as well. What have you found is the hardest part of growing your team?
Yeah, I think this is my first time being this like at this level of leadership within a company. I've definitely had like leadership BCBA roles where I'm like mentoring other BCBAs, but I'm really having a say in the policies and procedures that are going into like building this clinic that we've built. And I think the biggest pain point has been really looking at how do we function in a hospital system, right? So that system alignment has been a little tricky. And so we kind of have our own policies and procedures that are specific to our clinic, but also the hospital system's huge. And we are navigating multiple layers of policy, of compliance, and also interdisciplinary collaboration. So that's been kind of one struggle. And then one thing that I've been working a lot on, like I already said, is just really like promoting quality. How do we measure quality in ABA? How do we monitor it? And how do we do it solidly so we can kind of replicate the same quality that we're seeing in this first clinic?
Absolutely. So to kind of drill deeper in on that maintaining quality while still in a kind of brand new system, a system within a system, we should say.
Yeah.
How do you balance your time and your energy between shaping systems and doing the shaping of people, right? The mentoring, the leading side of the role.
Yeah, and I think as a BCBA, it's kind of embedded into your learning from the beginning, especially now that they've changed the verified course sequence to kind of include more like systems change and supervision courses as well. I think BCBAs are in this unique position to get a lot of background on how to manage people and teams while also being able to be effective in a clinic-based setting for patients or clients. So I think that is like kind of a unique position. And one thing that I like, one of my philosophies is that mentorship is embedded in, right? It's not just like when you need me, find me. We have a bi-weekly one-on-one on a calendar. So if you're a newer clinician in the clinic, you already have time reserved. And maybe like the BCBAs that I'm mentoring don't always need that time, but that time is reserved. So they're never having to like fit themselves in on my schedule. They know that that time is there. They can write their questions down and bring them. They, of course, could ask them whenever, but they know that they do have specific time reserved. And same with RBTs too. And we've really just kind of built that into our daily operations and team culture. We're really focused on psychological safety within the hospital system as a whole. So we've tried to embed that within our clinic as well. But at the end of the day, BCBAs can use the same principles with their staff as they can with the kids that they're servicing, right? So we're using OBM principles daily to create feedback systems that support both organizational goals and individual development for our staff.
That's awesome. That's awesome. Using the system to help you invest in people.
Yeah, exactly.
It's really cool. So from Michigan to Utah, you've worn hats as a researcher, as a clinician, as a consultant, and now kind of as a leader. Which role has changed or challenged your leadership style the most?
Yeah, I think consultation is probably the most challenging because it requires you to be influencing and have an influence on the system without necessarily having authority, right? Typically, when you're consulting, you're this outside person kind of being brought into a situation. And so you can kind of guide, you have to figure out how to guide teams and leaders who may not share the same vision or values as you, and really trying to be influential in that way, though at the end of the day, you don't have any say in what happens in that space, right? So it really kind of demands this like flexibility and diplomacy that is unique and it's hard, especially when you're navigating different organizational change or resistance in those settings. So I think for me, that has been the most challenging kind of shift.
As a recovering consultant, I completely agree. It is not easy. It is not easy to say, here, I know what the problem is, and I know how you could solve it. Will you? No idea, but all I can do is
So it's in your hands now.
exactly. All I can do is tell you really should, but now it's up to you. That's awesome. That's awesome. So, last question, and we have to ask this because we are a marketing and advertising space, even though I know your role is not necessarily marketing and advertising. But what is one marketing tactic that you're currently considering or watching really carefully in the market, especially in the ABA space?
So something that I am individually doing to kind of get Intermountain Health's name out there because it is a new service line. We're not a small company, right? We're a pretty big organization in the Mountain West region. But something I'm doing to kind of get our name out into the ABA space is this content-based outreach. So I'm really kind of exploring the use of educational products such as like CEUs, even like kind of doing like visiting CEUs or workshops at different companies beyond even just conferences to really kind of put out content on different topics that I'm knowledgeable in and that I'm confident in order to kind of get our name out there that way. So that's been my approach to it. Again, marketing's not my area, so that's just where I'm at.
That's awesome. That's awesome. Perfect. Well, thank you so much for joining us. We really appreciate you taking time and sharing some of your insights.
Yeah, thank you.
Absolutely.